Wait, got low. Wow, that hurts. Oh, the concert will finish. Oh, then let's go. Hey, do you know what teacher told just now?
The teacher just told about the human blood circulatory system, and the main organ is the heart.
Now let's look at the anatomy of the heart. From this heart model, you can see that the blue part is called the superior vena cava and the lower blue part is called the inferior vena cava, while the red part is called the aorta. Next, let's move on with the left part of the heart. First of all, the upper left part of the heart is called the right atrium, and the lower left part of the heart is called the right ventricle, while the upper and lower white part is called the semilunar valve and tricuspid valve respectively. Now let's move on with the right part of the heart. The upper right part of the heart is called the left atrium, and the lower right part of the heart is called the left ventricle, while the white part is called the bicuspid valve. There's a part that separates the right side and the left side of the heart, and it's called septum. Lastly, you can see that the blue capillary is called the pulmonary artery, and the red capillary is called the pulmonary vein.
Now just start about the function of heart. These are the structure in heart that has been told just now. The human blood circulatory system is start from the lungs. The lungs will punch the oxygenated blood to the heart. The blood enters the left atrium through the pulmonary vein. After that, the muscle of the left atrium will be contracted and the bicuspid vein also will be open. The oxygenated blood will punch from the left atrium into the left ventricle. When the blood enters the left ventricle, the left ventricle muscle will be contracted to punch the blood up, and the semilunar aortic valve will be open. At the same time, the bicuspid valve will be closed to prevent blood flow back to the left atrium. After the blood has pumped out from the left ventricle into the aorta, the semilunar aortic valve will be closed to prevent the blood flow back. The oxygenated blood in the aorta will be pumped to the body cell and body tissue. The oxygenated blood will transfer the oxygen into the body cell and body tissue. After that, the carbon dioxide will transfer into the blood. The blood that consists of carbon dioxide gas is called the deoxygenated blood. The deoxygenated blood enters the right atrium through the superior vena cava and inferior vena cava. After that, the muscle of the right atrium will be contracted, and also the tricuspid valve will be open. The deoxygenated blood in the right atrium will be pumped into the right ventricle. When the blood enters the right ventricle, the muscle of the right ventricle will be contracted, and the blood will be pumped out. The semilunar pulmonary vein will be open. At the same time, the tricuspid valve will be closed. This is because to prevent the backflow of the blood to the right atrium. After the blood is pumped out from the right ventricle to the pulmonary artery, the semilunar pulmonary valve will be closed. This is because to prevent the backflow of the blood to the right ventricle. The deoxygenated blood will be pumped to the lungs through the pulmonary artery. The deoxygenated blood will transfer the carbon dioxide gas into the lungs, and the lungs transfer the oxygen into the blood. Let the blood become the oxygenated blood. And the oxygenated blood is pumped to the heart. All of this is repeat again and again to form a full human blood circulatory system.
Hey Jody, do you want to join me for the basketball later?
I don't think so. I need to have a rest. Yesterday I played basketball, and you know what? My heartbeat went so fast.
It's very normal to have a high pulse rate during exercise. There is actually a disease of having a high or low pulse rate called heart arrhythmia.
A heart arrhythmia is an irregular heartbeat. A heart arrhythmia occurs when the electric signals that tell the heart to beat do not work properly. Your heart may beat too quickly, too slowly, or with an irregular rhythm. A heart arrhythmia may feel like a fluttering, pounding, or a racing heartbeat. Some types of arrhythmia are harmless and do not require any treatment, while others can put you at risk for cardiac arrest, which is life-threatening symptoms. In general, heart arrhythmias are grouped by the speed of the heart rate. For example, tachycardia is a fast heartbeat which heart rate is greater than 100 beats a minute, while bradycardia is a slow heartbeat which the heart rate is less than 60 beats a minute. A heart arrhythmia may be silent and may not cause any symptoms. The irregular heartbeat may be noticed during a health checkup. Here comes the symptoms of an arrhythmia, such as a fluttering, pounding or racing feeling in the chest, a fast heartbeat, a slow heartbeat, chest pain, shortness of breath, anxiety, feeling tired, lightheadedness or dizziness, and also sweating. And you may wonder, how is an arrhythmia diagnosed? A healthcare provider can find an irregular heartbeat during an examination by taking your pulse and listening to your heart. After assessing your symptoms and performing a physical examination, they may order diagnostic tests to help confirm that you have an arrhythmia. They will carry out tests like electrocardiogram, blood tests to check your electrolyte levels, stress tests, ambulatory monitors, echocardiogram, and many more.
There are some causes of heart arrhythmia such as heart disease, COVID-19 infection or fever, strong emotions like surprise, changes in hormone levels, things in your daily life such as alcohol, caffeine, or exercise. Besides, high blood pressure, anxiety, and stress will also lead to heart arrhythmia. Moreover, heart arrhythmia occurs when the heart's natural pacemaker develops an abnormal rate or rhythm. It is a problem with the electrical signals that control the heartbeat. Your heart's electrical signals control how fast your heart beats. A problem with these electrical signals can cause an irregular rhythm. Next, the imbalance of fluid or electrolytes in the blood, such as sodium, potassium, magnesium, calcium, and phosphorus, might cause heart arrhythmia. Lastly, the healing process after heart surgery is also one of the causes. Scar tissue in the heart from surgeries to fix a congenital heart condition can lead to changes in heart signaling. The changes can cause the heart to beat too fast, too slow, or irregularly.
Treatment for a heart arrhythmia depends on whether the heart is beating too fast or too slow. If not treated, arrhythmia can damage the heart, brain, or other organs. This can lead to life-threatening stroke, heart failure, or cardiac arrest. During cardiac arrest, the heart suddenly and unexpectedly stops breathing, causing death if it is not treated within minutes. First of all, water maneuvers. It will affect the vagus nerve to control the heartbeat. The types of vagal maneuver are Vaseva maneuver, coughing, and handstand for 30 seconds. Cardioversion. It is a procedure used to return an abnormal heartbeat to a normal heartbeat. This procedure through the petals on the chest to use a quick, low electrical shock to help to return the heart rhythm. Next, implantable cardiovascular defibrillator. It is a small battery-powered device under the skin near to heart. It can help to check or stop irregular heartbeat.